Okay, welcome back to another Lunch and Learn segment here at PROCare Physical Therapy. Today we're going to be talking about our rehab cycle and the million-dollar question, when to use ice or heat. I developed this rehab cycle a few years back to really educate my patients and my therapists of the cycle that patients go through when they have an injury and what they should expect during the rehab cycle. So on the initial evaluation, when you come in to see one of our therapists, we talk a little bit about your situation, your problem, your condition, and what limitations you have so that we can set up goals. So this is the last part of the rehab cycle. So we are going to start with phase one, and in phase one we call it the acute phase, meaning that you're inflamed, something's swelling, it's hot, you're dysfunctional, you can't do the things that you want to do in your normal daily activities. So if you look on the left-hand side of the chart here, you have what we call an awareness chart. And we have our pain level, okay? So pain can go from 0 to 10, and our functional percentage, which can go from 0 to 100. So red is our pain. So people come into us because they're in some type of pain or dysfunction. And so they're somewhere up high in the level of the scale. So they might be at a 6, 7, 8, 9, sometimes a 10. And usually they have a dysfunction, so their functional level is low on the percentage scale. Now, as we go through phase one, we're going to be doing a lot of things in physical therapy to get you moving again, reduce the inflammation. So we're going to be doing modalities such as, this is a time where you're going to be using ice. We're going to use some electrical stim. We're going to do a lot of patient education on what you should be doing at home or what you shouldn't be doing so that you can get things to calm down and heal. As we continue to move through the phase of the cycle here, again, this is your timeline or number of visits. So usually about 2 weeks is the phase for acute injury, or sometimes we'll have somewhere up to about 6 visits. As we move into phase 2, we call it the subacute phase. So your inflammation is down, the swelling is down, but you still have some range of motion problems, you still have some weakness and some dysfunction where you can't do something that you want to do that you've enjoyed in life in the past. So here we start movement therapy. We do a lot of hands-on stretching and mobilization. We do some light to medium exercises, and then we continue to do some patient education to educate you on the rights and wrongs of doing things. Now, you still may be doing some icing here, or you might start slowly moving into some moist heat depending on your signs and symptoms. If it's not hot and swollen anymore and your main complaint is really I'm just stiff and tight, then that's moist heat. If you still have pain, swelling, inflammation, this is still indicated to having ice. If you see in the middle of the chart here, we have what's called the pain threshold. And right here, we're seeing about the point of time where patients are now having less pain, more dysfunction, and we've crossed that line or threshold. Again, here is where patients that we find out that say, hey, I'm doing much better. I'm increasing my mobility. I'm returning to work, returning to sports, because my pain level is down, but there's still some discomfort, especially if you're poking or prodding or feeling around or moving at those end ranges, there's still going to be some pain. However, what we see is now they're telling the therapist is, hey, I don't have time for physical therapy anymore. I feel good. Thanks for everything you've done for me. And then they leave. And the problem with that is we have not started the strengthening phase or the functioning phase. And we've seen in the past where they go out, they're doing yard work, it's springtime, they're bending, twisting, lifting, carrying, and what happens? Boom, they re-injure themselves, they go back to the doctor, and the doctor says, well, I thought you were in physical therapy. I thought you were doing better. No, physical therapy didn't help because we as humans have short-term memories. So if we don't get into working the functional phase and the strength phase, there's going to be some type of re-injury here, and you're going to start back to square one. So we really emphasize not to drop off, to continue with about another week or two of physical therapy so that you don't re-injure yourself. So in phase 3, we call it the strengthening phase, and that's exactly what we're doing. We're working on core strength, extremity strength, functional strength to movement, working on proper body mechanics, how to move better, ergonomics, how to sit better at work, and continuing with some strength training in your core, postural training, and of course what we just talked about is education on not re-injuring yourself. So as you continue to get stronger, your function increases, your pain continues to reduce, and now we're in the final phase, and that is returning to sports, returning to work, returning to weekend warrior type things that you enjoy. And here is where we meet your goals and get you on a home exercise program so that, again, you don't have re-injuries and you know exactly what to do if you do have a flare-up of something, when to use ice or when to use heat. Now, if you do have a chronic condition, and that means you still have maybe some irritation, some limitation after physical therapy, most of your signs and symptoms are, I've got stiffness or lack of range of motion at my end ranges of where I move. That's still where an indication of moist heat. You're in a chronic phase. We need moisture. We need heat to increase circulation to those areas that need to be mobilized, stretched, and loosened up. Again, if you do have a flare-up in the yard, working hard in the garden, fall, that's again, you want to get back to using ice because you're going to have a flare-up and be a little bit acute. And then once that goes away, usually in about 3 days or 72 hours, you can go back into using moist heat and go back to your home exercises that we've taught you in physical therapy. Well, that's the Rehab Cycle at PROCare Physical Therapy, and hopefully you learned something at this Lunch and Learn. Thanks for tuning in today, and don't forget to leave a message or a question at the bottom of this page.